Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center reporting for the week of May 10th, 2021. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID 19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit questions in the comments by direct message or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending where you are. So, we're here to give you up to date information about Alameda County, Oakland, and East Oakland in particular. Alameda County has 87,637 recorded cases of COVID 19 and 1,546 COVID deaths, including 302 among skilled nursing facility residents. Vaccinations continue to increase, with 73% of the eligible population, which is currently those 16 and up, having received one dose, and 51.8% of the eligible population receiving all of the required doses. And this is just slightly lower for the city of Oakland. And we know that vaccination rates continue to be quite uneven, with our East Oakland zip codes of 94603 and 94621 having the lowest vaccination rate, just around 1/3 of the eligible population having received all doses. We also continue to see disparities in terms of death rates for COVID, with African Americans dying at about double the rate of the average for the county overall, and that is followed by Pacific Islanders and then those of multi race. By way of updates, Pfizer received approval from the FDA for 12-year-old to 15-year-old population, and the Advisory Committee on Immunization Practices, or ACIP, will be discussing this in detail in the May 12th meeting, at which time they will take a vote and put forward their recommendations around vaccinating those 12 to 15-year-old with the Pfizer vaccine. Pfizer has also put in their application for a full biologics license, which will enable the vaccine to continue to be used even after the emergency order is lifted for COVID 19. So today I wanted to take up a few of our viewers' questions, and I'll see how many we can get to today. I'm going to start with this question, which is, of course, coming up more and more lately. Do children really need to be vaccinated against COVID 19? So we know that children are much less likely to get severe disease or to die as compared to adults when they contract COVID 19. But there is a substantial amount of evidence that children can contract COVID at about the same rate as adults, and they also are getting long COVID at about the same rate as adults. So this is significant because, as we talked about last week, the risk of getting long COVID is looking like it's about 1 in 3. And so while long COVID is disturbing at any age, certainly being an adolescent or a child with persistent headaches, difficulty concentrating, difficulty breathing, or heart enlargement, or just the multitude of other presentations that come along with long COVID, this is certainly of concern. So we want to be thinking seriously and not dismissing the risks of COVID 19 among young people. And as I said, we know that children do spread COVID 19 and are, in fact, thought to have helped drive transmission in other states that have experienced recent surges, such as in Michigan, where some of the sports activities have been definite sites of outbreaks, and this is among school age children. And so, while there haven't been as many deaths from COVID 19 among children as adults, certainly, and there have not been as many severe or poor outcomes among children than adults, children still can get the virus and they can transmit the virus to adults. And one thing that is worth taking note of is that the share of children making up COVID cases in the United States has changed dramatically over the last year. And so the American Academy of Pediatrics reported out through April 29th of 2021, and you can see here that just about a year ago, COVID 19 cases among children made up just 2.6% of the United States total of COVID cases. And now they're accounting for about 22%, more than one in five COVID 19 infections in the United States. So this is a very significant shift. And there are a number of reasons that we know that are contributing to this. First, of course, is that these are our remaining unvaccinated population. So, as adults get vaccinated, we're starting to see case rates go down substantially. And of course, children remaining unvaccinated, they will naturally start to account for a little bit more of a share of the overall COVID 19 cases. The other reason that is thought to be significantly contributing, particularly in states like Michigan, is the emergence of the B117 or UK variant, which is more transmissible. Now, so far, there doesn't seem to be evidence that it is more transmissible in children than adults, but it is looking like it is more transmissible in general for everyone. So, as adults become more protected and children remain unprotected, and we are now contending with more contagious variants, we are beginning to see an uptick in terms of the percentage of children being infected with SARS CoV 2. And lastly, of course, we are beginning to open up more activities for children. Schools are reopening, sports and after school activities are reopening. And so this is just more opportunity for transmission. So, all of that being said, if children are so much less likely to get severely ill or die from COVID, then why should we be worried about them getting vaccinated? So, I think this really boils down to three main reasons. And one is an individual reason, one is maybe a family, household, and community reason. And then the last is a community wide or population reason. And so, first is that, as I mentioned, children still can get severely ill with COVID. I went over this in some detail with Dr. Mays in our February 16th People's Health Briefing, and we reviewed in detail some of the more serious outcomes that can happen with children, including a multi systems inflammatory condition that can send even very young children to the ICU or even cause death. And so, of course, as cases go up, just in general, as cases go up, hospitalizations go up and deaths go up. And so, even though we know there's a much lower risk of severe illness and death among children, it still exists. And so, what we don't want to see is that cases continue to go up and then these poor outcomes will accordingly go up. So the one is for the children themselves, is that we are protecting them from severe outcomes, but also from some of the outcomes such as long COVID. As I mentioned, this can result in a constellation of different kinds of symptoms, just like COVID itself, anything from head to toe, hair falling out to skin rashes to neurologic issues and memory issues, concentration issues, sleep problems, headaches, and also inflammation of the heart that, as we reviewed in a prior briefing, necessitates a full cardiac evaluation of a child after they contract COVID and before they return to sports, because the swelling of the heart or myocarditis that can happen with long COVID or post COVID can actually lead to sudden death upon exertion. And so these are all things that we want to be aware of. And when children become eligible for vaccination, these are things that it will be looking to prevent. The second reason is, of course, that children do transmit COVID 19. And there have been a number of studies that show that that transmission rate is just about the same as adults, with the exception of maybe small babies who don't cough or sneeze as much or as forcefully. But once you start to get into a little bit of older children, and we've seen some studies that have looked at household transmission and the fact that children and adults are basically able to spread it at roughly the same rates. And what we're most concerned about, of course, is that those children will then spread it to someone who has underlying medical conditions or someone who's older and who's still unvaccinated. And so, as I've shown before, here you can see a map of the United States and showing that here, just in California alone, we have 590,000 seniors who live with school age children in California. And so this is actually living in the same household. So this doesn't even account for children going to visit with other relatives. This is just those with seniors in the household. So, of course, we are hopeful that most of these seniors are vaccinated, but we know again that vaccination rates are uneven and we still have plenty of vulnerable people who are as of yet unvaccinated. So the last thing we'd like to see is a child also remaining unvaccinated, contracting perhaps even one of these more contagious and more virulent strains, and then giving it to someone who's at risk of a very poor outcome. And of course, we have seen this happen all too many times already in this pandemic. And now that COVID-19 is essentially becoming a vaccine preventable illness, we want to see this stop. Um, and lastly, I would say that in order to reach herd immunity, we are going to need children to be part of that vaccinated population. And so, approximately 24% of the United States population is under 18. And that is actually true here in California as well, with about 24% of our population in California being under 18. And so essentially, we probably can't get to herd immunity unless we have children getting vaccinated as well. So, both on an individual level, a household and family level, and on a population level, it is going to be important to include children in our efforts for vaccination. Second question: why do I need the vaccine if I have natural remedies? And so I actually went into some detail on natural remedies in the People's Health Briefing from December 22nd. And I went into some detail on a fairly short list of quite important and promising supplements, particularly vitamin D, which, if you watch these briefings, you know that I recommend vitamin D supplementation essentially every week. There's also some evidence around zinc and vitamin C, although most people do get enough of those in a multivitamin. So that's another thing that I recommend. And then getting plenty of sleep. And for those who have challenges getting plenty of sleep, melatonin may be recommended. And again, December 22nd briefing, I went over these in some detail if you'd like to check that out. And so this is not to say that we shouldn't be thinking about natural remedies. There's also plenty of herbs. And I know that a lot of people that I know and that have reached out have said that they take a number of nutritious and helpful herbs and supplements, turmeric and garlic and ginger. And we know that all of these things do have beneficial properties. And so we're not discouraging their use. But I like to be very clear about this, that remember that we are talking about the novel coronavirus. And what do we mean when we say novel? So, COVID 19 is a brand new disease caused for humans, caused by the novel or new coronavirus, SARS CoV 2. And before December of 2019, it was never ever seen before in human beings. And so our bodies literally do not have any immune defenses that are prepared to attack this virus. So that is very different from colds or seasonal flus. For example, because we have almost everyone has encountered a flu virus or a cold virus at some point in life, and you didn't necessarily get sick from it, but these were circulating in our schools and in our workplaces, and when we went to the store. We have all essentially most likely been exposed to some level of the cold causing and the flu causing viruses. And so our immune systems have developed antibodies to protect us in case we do encounter these viruses again. And that is just simply not the case with novel viruses. Meaning that, again, and none of us had any antibodies against this virus. It was brand new to human beings. And so at this point now, over a year in, the only people who currently carry antibodies against against SARS-CoV-2 are people who have either been vaccinated or they've contracted COVID in the last year and a half since it came on the scene. And so, to be clear, what makes the novel coronavirus so dangerous to us human beings is that we simply did not have any way to fight it. So, it's not necessarily that this virus is more dangerous or more contagious or it mutates more. None of those things are actually necessarily the case. But the thing about it is that when it enters the human body, we have no pre existing defenses against it, period. So our bodies just don't recognize it immediately as the foreign intruder that it is. And remember that even this far into the pandemic, the death rate has remained almost about the same for about the past year. One in 56 people with a documented case of COVID-19 will die on average in the United States. That's one in 56. And so over 580,000 people in the United States have died from SARS-CoV-2 infection. That is a lot of people. Many of them, I am sure, took herbs and supplements. Many of them had no pre existing conditions. Some of them were young people. Some of them were athletes. Some of them were in tip top shape. None of that helps you make antibodies. So, the only two things that are going to create antibodies against this novel coronavirus are either being infected, and let me be clear, being infected means you are just taking a gamble. We know that a lot of people do recover. We know that one in three people get long COVID. We know that one in 20 people will end up hospitalized. We know that one in 56 people will end up dead. So you are taking a gamble with trying to just take your chances and get naturally infected, or you get the vaccine. And as we've seen, these have excellent safety profiles and are very effective. And they do that job of exposing your body. So it will no longer be novel to you. You will have been exposed. You will have had the opportunity to create those antibodies and go on and continue those herbs as long as you know that they're safe and they're not conflicting with any medications or anything else that you're taking. Go on and continue those things because those things will actually may actually help you have a good response to the vaccine. There's even some studies that show that getting a good night's sleep and being well hydrated will also help you do even better when you take the vaccine. So these things are not either or, they're not mutually exclusive. You can take your herbs and your natural things and believe in those things, absolutely, but none of that is going to help you make antibodies. And that is just simple fact. And the reason why this virus has taken the world on in the way that it has and wiped out so many people, many of them across the world who have relied on herbal and natural remedies and who have deep respect for them, as do I. But again, we have to be clear on the facts and what's what, and those are just not going to be a replacement for creating those antibodies to actually fight off this very unpredictable virus. So until then, please continue with all of your layers of protection. For those who are eligible, 16 and up currently, get the vaccination. We will be listening to the ACIP's review, and next week we'll have some details on the Pfizer vaccine for 12 to 15-year-olds. Continue masking and spacing, and continue to test and quarantine after exposure or when you have symptoms, and avoid indoor crowded spaces. Remember that your best friend when you're indoors is going to be ventilation or fresh air circulation. So keep those windows and doors open whenever you can. If you are relying upon a HVAC system, it needs to have filtration of MERV 13 or higher, or you can purchase HEPA filters that are the portable type of units that are appropriate for your room size. And disinfection and sanitization of high touch and low touch surfaces is still important. But again, we want to really be avoiding crowded indoor spaces with people from different households and of mixed vaccination status. And we want to ensure that we have proper ventilation if we must be indoors. Take a multivitamin supplement and additional vitamin D supplementation. keep your stress managed, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10. See you then.
Our Soldiers Against Tobacco advocacy team are working on a smoke-free multi-unit housing initiative to address tobacco-related health issues in Oakland.
Our goal is to educate Oakland residents about the harmful effects of tobacco use, empower Oakland residents to advocate for community health, and increase access to clean air through our smoke-free multi-unit housing policy recommendation that is fair for Oakland tenants and property owners.
The problem with smoking in a multi-unit housing complex is that when one person in the building smokes, everyone in the building is impacted. Smoke never stays within the smoker's units. Instead, the smoke travels through windows, doorways, cracks in the walls, ventilation system, electrical lines, and anywhere the smoke can seep through.
The smoke enters into units where non-smokers live, which puts them at risk of developing health issues such as asthma, lung cancer, COPD, and more. Approximately 50,000 non-smokers die from secondhand smoke exposure every single year.
Advocate for community health. Join our efforts and support a fair, smoke-free multi-unit housing policy in the city of Oakland.
To learn more, please contact our Tobacco Policy and Advocacy Program Coordinator, Kiona Parcell Roos at kiona@rootsclinic.org. Thank you.